Hi, I'm Dr. Christine Rankin. We're here today with South Metro Wellness Clinic. Welcome back to our channel. Overall, it's been a pretty good week. We had a lot of new visitors here over the last week. I would say Monday was my first day back with patients who speak only Spanish, so that was certainly a challenge, but it has had its ups and downs, but overall we've come pretty far. So we had some interesting questions that came up with both sides of our bilingual practice here, and so that inspired the topic for today's video about how the nervous system actually works and what you do when you come to see the chiropractor. So one of the biggest concerns or questions was, why do we need to be seen so many times? Why does chiropractic work the way that it does, and how is that going to work for me? So the chiropractic treatment that you're going to receive when you come in is always an estimate based on the number of years or the number of complaints that you have. So let's say you've been walking around for the last 10 years with headaches, problems in the nervous system, a little bit of a scoliosis, pelvic unleveling. Maybe you had a slip and a fall or a car accident a number of years ago and your low back has just quite never been the same. Okay, so that treatment plan is going to carry a higher or a heavier value than someone who's in their mid-20s and has never experienced a car accident, has never had a trauma, never had a slip and fall, and is coming in because they have just the headache. Okay, so if we take out the low back pain out of the equation and we have no really significant problems in the middle of the spine, and it's more so just what's going on with the cervical spine here, shoulders and suboccipital muscles in the back of the neck or the back of the head. That's what's causing the issue. Well, that treatment plan is going to carry a lower value. That person's going to need fewer visits and going to probably need fewer therapies, and they're going to progress through care a little bit more quickly, or a lot bit more quickly, than someone who's had 10 years of damage. And so the reason we explain that is, once we go in and start to change the way that the spine is structured and repair some of the damage and take some of the tension out of the muscles, what we're really doing at that point is very similar to wearing a retainer on teeth. Many of you know I had orthodontic care in January of 2018 was my first day going in. And I didn't get done with my Invisalign trays until the end of July in 2019. To this day, if I don't wear my retainer enough, and I've tried this several times, trying to get away without having to wear that retainer constantly, or at night, or if I forget, or I'm just tired and I don't wear it, I can tell the retainer doesn't fit correctly and my teeth hurt as they go back. So once your alignment has been set, it's very important to keep it that way. And the reason is your nervous system recognizes what a normal was for you as an adult. So after you've had treatment for 4 or 6 months and everything is going the way that it's supposed to go, we recommend a treatment plan that's for qualified maintenance care, which prevents the problem from returning. And it all comes down to how we treat the nervous system. Every single time you come in for a chiropractic treatment, you feel pressure and pain being released from your spine. But what we're really doing underneath of that, behind the scenes, if you will, it's taking pressure off of all of the nerves and allowing them to flow freely. Chiropractic is more so an assistant to the healthcare. It's not the be-all, end-all. Your body is doing the healing. We're just removing the nerve interference that was keeping your body from performing at its optimal level or from you feeling like your absolute best self. So we go back and explain that using our nerve charts here. Okay, and why is chiropractic care and frequency so important? Well, after we've gotten treatment, we have to make sure that these nerves are functioning optimally because they innervate every organ, cell, and tissue in your body. And all of that comes from what we like to refer to as innate intelligence, which comes from your brain telling everything what to do and how to maintain its health and wellness. All of these things can be traced back to the spine. So there are lots and lots of issues that people think that can't be treated with chiropractic, like we talked about in our last 2 videos, that were not just slips and falls, but extremities, colds, flu, and as a preview to some of our upcoming videos, issues that children have that we think are medical issues that easily could be a chiropractic problem. So how do we decide what's a good frequency for you? This also came up this week, and it's very interesting because there's a little bit of gray area there, and this is where some of the trust comes in. So I'm asking my patients to trust me just a little bit as they move forward with their care and decide to stay healthy and well. Your body adjusts with a certain amount of stability. So when a patient is coming in 2 times a week, at some point we expect their body to say, hey, that second visit that week, probably wasn't all that necessary. Okay, so what we would do is that we would conduct another exam and figure out if it's going to be appropriate for that patient to move down to 1 time a week. Similarly, when you're coming 1 time a week and it looks like everything is very, very stable, there's not a ton of motion, there's not a ton of loud audible releases, and your posture has been maintaining itself and you're doing your exercises very well, we can start to see a progression there where, hey, let's taper off again and go down to 1 time every other week, 1 time every 2 or 3 weeks, if you will, and add in a massage here and there. So you can start to tell how a person's body behaves. We get to know what is normal for them, and at that point, both the doctor and the patient will agree based upon the findings from the exam, as well as how you're feeling overall. Are you having any symptoms between day 1 and day 10? Before you have a second adjustment? Do you have any symptoms? Have you felt stable? Have you felt strong? If the answer is yes, then you may be a good candidate to be seen a little less frequently. So there's a couple of different varying factors that decide when we see patients and how often we see patients, but it's always upon what is best for them. And it always comes from exam findings and the doctor and the patient trusting each other and working together. So I wanted to take this time to have another video and describe these types of things. It is a question that has come up a lot this last week, so we do have some other videos coming down in the future by request. We will go ahead and get to those. It's just that this particular week, we had a lot of new patients, some people trying chiropractic for the first time, and some people who have seen a chiropractor before, but it has not been anything near the experience that they're having now for corrective and wellness care. Going back to a previous video, probably a couple months ago, two different things: chiropractic care for pain relief, chiropractic care for wellness and corrective. Those are two very, very different things. Not saying that any other chiropractic care is not as good or not as appropriate. They're just very, very different, and it all comes down to what's best for you, where you're living at that time in your life, and what you feel is best for your health care. I'll put my spine back together so he doesn't feel abused. And with that, thank you for tuning in. We will see you guys next week, bright and early here, probably 9 to 10 o'clock here on a Tuesday morning, somewhere in between them. With that, this has been Dr. Rankin at South Metro Wellness Clinic here in Burnsville, signing off.